Thanks very much. I'm going to start talking about what quality means to me, and I think that quality starts by being selfish. Here's my vision for healthcare. It starts by focusing on what I, as a citizen, need and want. More and more of us have the ability and the means to find out exactly what we want, and presumably that's going to make us happy. Let me explain myself. I work for a large organization. Vancouver Coastal Health is home to some 20,000 employees, physicians who work at hospitals and health centers serving more than 1 million people. We are bound by something that we call our people-first philosophy. This stems from an 800-year-old concept of nothing about me without me. The idea is one of the roots of Western philosophy. It actually is formalized when King John signed the Magna Carta at Runnymede in 1215. At VCH, it means that with every decision we make, we try to remember there's a person impacted. Sometimes it's a patient, but it could be an employee or a physician. So who's the patient in this picture? The answer is they all are. I have a vision of a healthcare system where healthcare providers see themselves as patients and plan and make decisions as if they were the patients in the room. To further make my point, I'm going to steal from Don Berwick. In his paper called My Right Knee, by the way, we copy ideas in healthcare all the time. We call it adopting best practice. Don says that better care comes when we see the patient experience as a mirror of our own life, and to remember that as patients, we don't want 5 basic things. First, needless deaths. Don was waiting for knee surgery, and as a physician, he was aware of everything that could go wrong. So his plea was, don't kill me. Infections, botched transfusions, medication mix-ups all happen. But if we were planning our own care, we would do things to lessen the odds. Second, needless pain. Sometimes we're so focused on fixing the underlying problem that we cause needless pain in the process. Do you know that that exam hurts, that needles scare me, that I'm so worried that I can't hear what you're telling me? We all cause further pain when we fail to remember these things. Third, helplessness. Whether it's making treatment decisions without a patient's involvement, or failing to listen to them, or making them wear bad hospital gowns, we inflict a sense of helplessness. And when a patient feels helpless, their recovery is slowed and quality suffers. Fourth, unwanted waiting. Patients are busy too. They get mad when we leave them in the hallway, or make them wait 4 months for test results, or delay their discharge for 3 hours just because the doctor's signature is missing. Patients are people just like us, and we all hate waiting. Fifth, waste. Waiting and waste go hand in hand. It may be duplicate tests, or unnecessary tests, or even admitting patients when they could be cared for at home. Why don't we all follow the good practices of the Choosing Wisely project? You haven't heard about it? Look it up. In my vision of healthcare, the patient is in the middle, and we identify with their needs and wants. As a result, quality is so pervasive that these harmful things don't exist. What if we entered healthcare with the confidence that we call from the best experiences of our lives? Now, for each of us, that experience may be somewhat different. Maybe it's Christmas morning. You don't know what awaits you for certain, but you're pretty confident it'll be good. Well, aside from the occasional 7-year-old boy who lies awake wondering if he might be on the naughty list. Now imagine if we could give our patients entering our care system this happy anticipation. Maybe it's Disneyland. This is a place that can really manage expectations. At Disneyland, you may have to wait in line, but if the sign says 30 minutes, it's usually 30 minutes, and you know the end result will be so good that it's worth it. Hospitals may never be the happiest place on earth, but there's a middle ground between that kind of experience and overt dread. Maybe it's the birth of a child or grandchild. You go into this experience feeling nervous, but you're surrounded by a support system of doctors, nurses, family, and friends who can provide good advice. And above all, it offers the promise of a new life ahead, just like healthcare should offer. For me, the experience is ice cream. I love dulce de leche ice cream. I can close my eyes and taste it. And if we all went to my favorite gelato shop right now, I can guarantee the experience would be better than you imagined. Picture a hospital where patients get the exact experience they hoped for, or even better every time. I believe there is a common ground between these best experiences and where we want to be in healthcare. It doesn't necessarily take more money, but it does take vision, and it does take a will to do things differently. So, for example, across VCH, it's already happening. At Vancouver General Hospital, staff introduced a Clostridium difficile infection program and decreased those infections by 30% over 6 months. They protected over 112 patients from harm. They decluttered hallways, they got patients on appropriate oral antibiotics quicker after surgery, they saw the hazards, they made the changes, and prevented the needless harm. Staff at Richmond Hospital noticed a disproportionate number of their patients were falling. Through the Releasing Time to Care pilot you've heard about already, local leaders were empowered to make changes. You've already heard from Audra. Guess what? Falls dropped by 30%, patients went home sooner, they prevented needless pain and waste. Now, technology is also helping. We're testing ultraviolet disinfectant machines that kill superbugs and help contain outbreaks. These guys are small and quiet, but lethal to germs that cause our patients needless pain. It's actually an administrator's dream. Close the door, turn out the lights, and alakazam, you come back, and there's a clean, safe room. So that's where I want to be. I know mistakes are part of healthcare. We all are human, after all. But if healthcare is to be sustainable, we must create a patient-centric world that starts and ends with reliable, quality care for patients and ourselves, who exist together selfishly in the middle. Thank you.